I want to thank everybody for showing up for something to talk about Monday, Wednesday, and Friday at 11:30. We have these get-togethers and have a variety of topics. Today, we're going to be talking about COVID, which has been unfortunately a perennial topic. I want to start by saying that Something to Talk About is sponsored by Fieldstone Memory Care of Bainbridge Island. Innovative and compassionate care worth the wait. Call 360-271-2530 to schedule a tour. Fieldstone's beautifully appointed apartments on Rolling Bay today. And we have some great folks with us today to talk about COVID and where we are. We have the inimitable Fredric Hoffer, doctor and very active. He's you're a pediatric neurologist, is that right, Dr. Hoffer?
Radiologist.
Radiologist. And he also has been very active in the vaccination clinics, which have been ongoing, both at the senior center, at Commodore, and also he and his wife Donna have been doing a lot of mobile clinics, and we are grateful for all of your efforts. We also have Richard Davis with us. Richard is a maverick of the internet and has been following the activities, the numbers out of the county and the state very closely for about 2 years, right, Richard?
Since day one, I figured that was going to be my ticket out of this mess. Was know exactly what was going on, exactly when it was happening, and take the best information I could find. And I'm also an alumni of the Senior Center vaccination program, both shots, because my caregiver, my hospital group, canceled me right in the middle of setting up. They gave me an appointment and then they said, well, we decided not to do it. The Senior Center was right there. So I will forever be grateful for it. Made it. I'm an elderly person and I'm got comorbidities, and I wanted my shots, darn it.
So not only the Senior Center was involved, obviously the Medical Reserve Corps of Bainbridge Prepares, the community pharmacy, Bainbridge Community Pharmacy, and the city of Bainbridge Island, as well as the Bainbridge Island Fire Department. With us also is Loren Bast, who is the executive director of Bainbridge Prepares, and he's getting ready to fire up another clinic this weekend. Loren, thanks for joining us.
Absolutely, Reed. I'm honored. And so, really quickly, if I could just say one more word about Fred. So I believe we had over 50 or 60 vaccinators registered with us throughout our clinics. Fred was, I think by a few hundred shots, the most active of all of them. So just want to add that little highlight to his resume.
1,669.
Hey.
Wow.
But who's counting?
The pharmacy.
That's right. The pharmacy is counting.
Yay.
So I know that Loren is a little tight on time because he has obligations in the soccer field, I think, as well as setting up a clinic this weekend. So I thought that although we had talked a little bit about kind of setting the stage, maybe we'll do this in reverse order and have Loren talk a little bit about what that group is doing now to respond to the immediate need of shots for boosters for the immunocompromised.
Yeah. Well, thanks again, Reed. So yeah, what I can tell you is, boy, we thought we wouldn't have to do this as soon as we had anticipated back in June. We thought we were going to get the entire summer off and then leisurely, have a return to boosters and kids under 12 and all that. But with the flare up of Delta and, the federal government essentially giving the green light to boosters, we started to get a lot of questions from the community, not only about vaccines, but about the general COVID response that we were known for back in the spring and the winter, which was testing and PPE and all that. And so I'll address the vaccine clinics first, and then talk about the other stuff a little bit. Even though vaccine supply is much more available now than it was, at least in terms of the actual vials of vaccine, much more available now than it was back in January and February. What we've been hearing is that all of the clinics that, all the normal primary care clinics that the public health response was trying to transition immunizations to. When you go for your annual checkup and if you haven't been vaccinated, have your primary care physician, give you that shot. They are currently swamped, both nationally and countywide, because of general COVID care and the need for testing. With a over 30% positivity rate in testing, a lot of the clinics are like, look, we are just responding to all the people coughing and coming in, thinking they have COVID. We can't also worry about giving, immunizations. And so we decided, so that's the primary care clinics. In terms of the pharmacies, they have now just started getting barraged with requests for appointments, and they're running out of appointments for both shots and tests. They have to fill prescriptions, they have to do all that sort of stuff as well. So we decided to test the waters, open up a 90 slot clinic this Sunday, just to see how quickly those slots would be taken up and all that. And they were taken up within a few hours. We did a little bit of vetting, make sure that the folks that said that they were immunocompromised actually were. Basically, we're going to go ahead with that clinic on Sunday afternoon at the Senior Center and revisit our plans in terms of how soon we need to do another clinic. Before everyone is eligible come the end of September. One thing I will add to that is one of the benefits of doing a clinic in today versus back in February, March is that the CDC back in May granted the ability to combine immunizations. So if you need a shingles shot or if you need a flu shot, you can get it at the same time as your COVID shot. And so we are working with the community pharmacy to essentially get you up to date on your immunizations. We're not offering that this weekend because it's becoming flu season, but all the doctors we spoke with have indicated that getting the flu shot now is maybe a little bit too soon, but definitely by the end of September is when you want to start offering that. So we are planning on September 25th to be our first really big clinic to combine both COVID shots and flu shots and potentially other immunizations as well.
Okay, so to recap, right now you're helping with the pharmacies who are deluged and the primary care physicians deluged. So we're the Bainbridge Prepares Coalition, which includes the city and the fire department and all those folks, IVC, we haven't mentioned them yet, but they're integral to getting people to these clinics. You're going to do some clinics to help take the pressure off for people who need a booster because they're immunocompromised, and the details of what those are available on covidbi.timetap.com. And then you are planning public clinics for boosters late September 25th, you said.
Yes, that's the first definite clinic that we're going to have after this Sunday's clinic, although it's likely that we're going to do at least one or two other smaller clinics in between this Sunday and the end of September.
Okay, specifically related to clinics or boosters, does anybody here have a question for Loren? It looks like Karen does, and then Sheila.
Yeah, look, thank you so much, Loren. I had I received the thing from Nixel saying that the booster is ready for immunocompromised. but I have this weird thing. I have to get gamma globulin infusions about every 3 months. And so I had to check with my doctor to make sure that I was up to date on that in order to get the booster. It took me a couple days. And of course, when I went to apply, then it was all filled up. So it was good to hear that you are going to be offering something, another one for people, because I'm sure I'm not the only person that had to check with their doctors before signing up. So
yes, we heard a number of people had questions that, you know, because we are the amount of medical advice we can give is limited. We essentially do have to, unless it's some basic, you know, question and answer, we do have to, you know, turn them over to the primary care physician, get clarification. Sometimes, you know, their physician will talk to us and say, don't give them a Pfizer, give them a Moderna instead, or, you know, basically adjust the dose this way. And then we're able to act on that. But we do anticipate, like I said, it's not just you that missed out on those 90 appointments. We have a number of other individuals. And so, you know, again, we were testing the waters, and that test is starting to produce results in terms of how much demand is out there. And so based on that, it's very likely that we're going to have another clinic, you know, before the end of September.
great, thank you. There's a lot of us sharks in that water that you're
Yes.
Thanks, Loren.
Okay,
Yep.
Sheila.
Yeah, Loren, I just wanted to check with you because with IVC, you guys got all together and came over here to Winslow Arms twice and inoculated us at that time. The last one that you came over here was the February 1st. I'm just wondering, does that mean that you guys are probably going to come back over here the 1st of October and do the booster shots for us or not?
So that's a little bit about the mobile clinics. It also applies to Bainbridge Senior Living and Virginia Villa.
Yes. So the answer is probably. And if I could just say, Fred was another one of those that I think he cross-country skied to get to that second dose clinic at Winslow Arms, because that was in the middle of the snowstorm. But it's likely that we're gonna have to reactivate our mobile team. We've already been getting requests from some of the nursing homes that we did back in the winter to say, hey, our residents really want you back. Let us know when you can get back in here. So it's, you know, the data's coming in. It's very likely that we're going to be, you know, ramping things back up, you know, similar to how we did it back in the winter, in order to basically get out to those, you know, those groups such as Winslow Arms that would have trouble going to, you know, to another clinic.
Thank you. I'm going to thank you for attending and participating and giving us this information. Bainbridgeprepares.org is also a great place to find out the latest information, in addition to covidbi.timetap.com. We have a lot of ground to cover, so I'm going to keep moving if that's okay with you, Loren.
Absolutely. And I'll probably check out from here on out.
Okay.
Thanks,
I'm going to turn to Richard, who can maybe give us a little context about what the status is, the infection rates, the fact that we're at a all-time high of infection on Bainbridge. I think at least can you give us the details on exactly what those numbers look like? And then Fred can maybe explain to us a little bit about why.
Sure. You can go too deeply in these figures trying to find the nuggets of truth, and it's all trends. It's all what's happening. You know, Kitsap Public Health actually changed the way they reported the figures about a month ago, whereas they were on a 14-day total for infection rate. They've now reduced it to 7. So when you see the Kitsap total, which is 200 per 100,000 people, per 7 days, that's actually 400. 400 might get your attention more than 200, although pretty much through the history of this, Kitsap's been kicking around the 40s, 40 per 100,000. Now, when you talk about Bainbridge, we don't have enough people to even be more than a fractional amount greater than 25% of that 100,000, which is why that is used, so you can compare and compare. As a rule, from the history of this, from March 2020, we have been averaging about 1/3 the infection rate of Kitsap County in general. Okay. However, when the spikes occur, I noticed that we are 50% or greater Kitsap. Now, again, we don't got a lot of people here. So, so if I get 2 additional infections in a week, oh my God, it went up 32%. Well, yeah. However, in this case, the Delta variant is so clearly, it's got a higher R0 number. It's got,
And the R0, for people who are catching up, is its infection rate, basically how many people an infected person is likely to infect.
right. I mean, for instance, Alpha, the original, the standard COVID, which killed some in the United States, 600,000 plus probably another 100,000 excess deaths that were caused by the introduction of the COVID infection into somebody who was compromised. It did it all by itself with a R0 number of about 2. Delta is like 7 or 8. That's the best number. I've heard as high as 9. I've heard as low as 5. So I say 7. It's a very infectious thing. That piggybacked on top of the reopening has got us up to about 55% of the background infection rate in Kitsap. So a lot. There's a lot of cases here. There's a lot of infection here. I'm sorry. The prognosis, I'm not going to say we're at the top of this, but the spiking, and this is all, remember, everything you see in these numbers is a week ago, 2 weeks ago. Doesn't tell you what happened last week. Is it going to go much higher? Is it going to double again? I don't see doubling coming up here. Part of that is people get the idea when their friends show up in the hospital. This is an interesting data point for you. Hospitalizations, which a lot of people, especially when they want to argue, they rely on to show how desperate a situation is. We are at an all-time high in Kitsap. Granted, we only got a couple of hospitals, but of 34 patients. We usually have, over the course of this, 5 to 7, maybe. I realize a lot of Bainbridge Islanders go across the water to the hospitals there. But in Kitsap, that's significant, and it shows a huge spike. And again, these tend to be not necessarily the original targets of COVID, which was people 65 and up. This is in an age group moving down into the 50s, I believe, is the new average in Kitsap. And then we also have, I'll ask Dr. Hoffer this. I don't know if you have to be hospitalized for myocarditis if you're a child, or if that's handled by strictly medication or a doctor's visit.
So go ahead.
Yeah, no, I didn't want to forget to ask you that, because school's coming.
I don't think you have to be hospitalized for myocarditis unless there's if you need to be treated for some way that you need an ICU bed or something like that.
So this is you're referring at this point to the heart condition that has been associated with this disease, right?
Or the disease. That's right. Either the disease or the vaccination.
That's right.
As one doctor said, when we start filling up the ICU from complications of vaccination, we'll let you know. But right now, we're filling up the ICU with complications of those who are not vaccinated.
That's a perfect lead in to the next number I'm going to give people, which is hospitalizations by vaccination status. Of that 34, there are 31 that were unvaccinated or not fully vaccinated, and 6, I know that doesn't add up, but I'm just reading off Kitsap's numbers. 6 vaccinated. were fully vaccinated. That is what I would expect to see. I would expect to see on a good day, you're going to go 5 to 10% vaccinated people. So our numbers are well in line with that. What is unusual is the ICU beds in the hospitals here really are filling up. And certainly much worse in Mississippi. I mean, insanely worse in Mississippi and Louisiana. It's bad here. And we're certainly, I would say we're above the national average for new infections across the country. We're up in that upper tier without being the worst, which seems unusual because to a large degree, public health has done it the best they can and a lot of things right. So I just watch the trends. Everything is like in a 2-week window. I'm one of those obnoxious people who will let you know that I never stopped wearing a mask.
Yeah, so we're going to talk about that and why it turns out to be not a bad way to go with Dr. Hoffer now. Can you tell us a little bit, Fred, about the differences between Delta? They were hinted at a little bit from Richard, and the original Alpha or whatever, the version that we were being inoculated against when this started. Is there a significant difference in the way that the virus attaches, or is it just that there's a lot more viral load? There's a lot more infection when we catch a Delta variant.
I know it's doing a lot of spreading. Actually, it's being spread by both people who are vaccinated to even other people who are vaccinated. We thought in the past with the previous types that a vaccinated person couldn't spread a disease to another person, but the viral load is probably 1,000 times as much, and the early viral load is kind of like in the nose and mouth, where it could easily spread to another person instead of later when you're symptomatic being in the lungs. So these people can even be asymptomatic. And it's frightened us. I've been consulting with 2 choirs about what to do, and we're thinking we have to be outdoors and perhaps even masked with this Delta variant to be safe. And it's the other thing that's kind of frightening. It may be part of the problem is the Delta variant, but I think part of the problem might be our waning immunity against COVID. And if I could talk about that for a few minutes.
That'd be great.
There was a nice article out of Israel that was shown to me by Patty Schwartz's husband. And Israel has actually followed people very closely. So they have now, even though they've had 78% of their people vaccinated over the age of 12, they've had 650 new cases per million people. And maybe Richard, you can give that kind of context. That would be us saying, 65 cases per 100,000. So there's a lot. And just looking at what they found is that they found that more than half of those people are fully vaccinated. And that's what's frightening. So people are getting COVID and out of their population, unlike what you just said, our population, over half, the vaccinated people are getting sick. So they found that the protection from COVID-19 infection during June and July dropped in proportion to the length of time that they were vaccinated. So people who were vaccinated in January had 2.2 times greater risk of breakthrough infection than those vaccinated in April. So some of the problems with the Delta variant may be in part due to our waning immunity. The other thing that's interesting is that there was 500 Israelis who were hospitalized with severe and critical COVID, and these were 59% of those people were fully vaccinated. In the past, we thought, well, with the A and B and C, that we could get sick if we got COVID after immunization, but we wouldn't actually get hospitalized or die. But of these people that are hospitalized in Israel, 59% were fully vaccinated. So this is frightening. The other thing that's quite interesting is that, you know, we're thinking about booster shots, right? So they did starting booster shots in July, and they started with people over 60 years of age, like most of us on this call. And then they expanded it recently to 50. But what they found is that the people who got that third shot were half as likely to get hospitalized as those who had only had two. So there is evidence that the booster can help. I mean, it's and just for your own benefit, 88% said that the third shot wasn't, the side effects were less than the second shot. So it just tells me that this booster campaign that we're going to start may actually help. I think the other thing that people are considering with Moderna and Pfizer is a specific vaccination for the Delta variant itself, but that is not quite ready. I mean, I don't think they'd have that ready until the end of the year.
Right. So to clarify there, the vaccines that we got at the beginning of the winter that might be wearing off now were designed and tested against alpha. And so that means that there might be some, they could in theory create a more targeted version of a vaccine that would focus on Delta. But even getting a booster against alpha is going to be superior to no booster at all, it sounds like.
Correct.
Now, the World Health Organization came out with some criticism about this idea of boosters, saying that the real issue is that the whole world needs to get vaccinated at least one time, and that by doing boosters or putting our energies on boosters, we might be actually allowing for a lot of the world to not only get very sick, but also allow the virus to continue to mutate. I'm guessing that there's a different response between what the federal governments of the world should do and what I as an individual should do when confronted with the opportunity of a booster. Is that fair to say?
It's very fair. I think, you know, we're doing America first, you know, Israel's doing Israel first. But it's even difficult to get some of the vaccines to the third world countries. Some are being distributed and not used and expired. So there has to be a huge effort. You know, there may be something that probably will be something that more dangerous than Delta that comes out. And I think we just need to be as vigilant as possible, making as much vaccine as possible, exporting as much, and getting help, just like we did for polio. You know, it's going to be a huge challenge and a huge job.
Now, can we transition a little bit here about from the infection to testing? One of the things that we're being encouraged to do now, Dr. Gib Morrow, the health officer for Kitsap this week, was talking with Josh Farley, the Kitsap Sun, and encouraged us, even if we feel a little sniffly, to get a test, because it will be helpful in identifying the where the virus is, and helping to slow up, you know, change our behavior. So there are a couple different kinds of tests. There's the sort of rapid test that I might be able to buy at Walgreens or Rite Aid or Safeway or the community pharmacy, and then there are PCR tests. Can you describe what the difference between those are?
I'm not absolutely sure. I think the home tests, or the ones coming out of the pharmacy, are what they call antigen tests, and they're not quite as sensitive as the PCR test. If you're going to be traveling, you need the PCR test. I just went to Canada, and they would not accept an antigen test. But I'll tell you, I mean, even if some of these things are coming out negative on the antigen test, I think we recently, and Richard, you can help us with this, I think our positivity rate is somewhere between 20 and 30%. So that's frightening. Is that right, Richard? You are silenced. You're silenced.
You need to unmute.
Yeah, the number for the last 2 weeks has been somewhere north of 30%. The state, Washington Health Department, says that they haven't added in all the negative tests, but this is 2 weeks running. Taking them at their word, you're still upwards of 20% in terms of positivity. And in the whole history of the pandemic in Washington State and Kitsap County, we never got over 10. So it's big. How about that as a scientific answer? It's way big.
So just to let people know, it's nice to have a home test. I mean, the White House had a home test and they had an outbreak, but and it may show up a positive. But at 23%, I mean, my gosh, some of the home tests are going to be a positive too. So people will probably go to home tests because they're easy. They can do it at home. They can do it quickly. But if they need more information, they need to get a PCR. To be honest.
What that really means then is that 1 out of 4 people or 1 out of 5 people have COVID. So you can think about it. You walk into TNC, let's say there's 100 people in there. Quarter of them are going to be
Oh, these are among people that think they might have COVID.
Right. But
so there is there is some sort. It is not a blanket test of all people, which means
that's true. But
which means that it's not quite that serious. But what is different is that early on, when people thought I might have COVID, got a test, and many of them did not. Now most, or not most, but a large percentage of them, a significant percentage do. So that kind of gets us to the next thing that I want to make sure we touch on, which is behavior. So obviously, we're getting guidance from state and federal and health officials to wear masks more often, vaccinated or not. Fred, you were talking a little bit about talking with choirs about singing with masks or singing outdoors, or a combination of those two things, because obviously when you sing, you're sending a lot of aerosols into the air. That's part of the beauty of the whole thing, is hearing people.
Especially with your T's, P's, and F's. I would think all those things that you expectorate. Yeah, it's frightening. I think, we say, well, we don't need masks indoors if you're not in a public space. What is a public space? I mean, I live in the grow community, and we're still not quite doing what we did before, and we're still not quite as frightened. Our behavior hasn't changed as much, and it's now worse than it's ever been. So it's we only solace is that, okay, we won't get that sick if we've been immunized, but people can. So I think we all need to think about the people we can get infected, rather than thinking about ourselves when we're wearing a mask. And I know America sort of thinks about themselves more than other people, but you can get kids infected if you get infected and not wearing a mask, and kids are getting sicker, and pediatric ICUs are getting fuller. And it's just, you have to think about other people and change your behavior that way.
And we don't know, I'm guessing at this point, the Delta research is fairly young because the variant hasn't been out there that long. Whether the reason that kids or younger people are getting sicker is because there's something more deadly about this variant, or that it's just that it's, as you said, 1,000 times more virus. It multiplies faster.
Most people think it's not a worse infection, it's just more communicable.
More communicable.
Actually, there are two real world examples, India and the United Kingdom. The UK is about 80% vaccinated. They've done an amazing job. And India is about 10% vaccinated. And they both had the same spike. It was taking available hosts. That's all it cares about. It doesn't care about how many vaccinated people are. They're looking for hosts.
Wow.
And they had the same spike. And the problem is, it drops down fast. I expect Delta is going to be like 60 days in terms of like a big thing. here in Kitsap. But the problem is your baseline doesn't go down. Your baseline goes up. So if you were used to 30s per 100,000, all of a sudden you're starting to see 45s and 50s. That's one of the continuing problems with Delta. Sorry, I didn't mean to.
No, so can you explain that a little bit more? So the idea is that we can expect that that the communicability of this is going to go up?
No, it tends. I don't know why. I wish there was a doctor on the panel. I don't know. I don't know why, but in both India and UK, India where there are birdie bodies in the streets, and the UK, which basically had to go into a modified lockdown, one is 80% vaccinated, one's 10% vaccinated. It is highly transmissible, is my point. And yeah.
The one thing is a little bit reassuring, though, is that these peak and then they come back down. So who knows what herd immunity is going to be? I mean, Fauci has talked in the past, herd immunity would be maybe 70% of the population. Now it might be 90% of the population needs to have herd immunity to make this thing slow down. But the peaks are quick up and down where it's come through.
So we do have some change in public health, even if we have some COVID fatigue, which is causing us to behave not as cautiously as Dr. Hoffer is suggesting we should. We are now, at least in the state of Washington, teachers and school staff are being directed to get vaccinated. Nursing home and assisted living staff are being directed to get vaccinated. So that may help a little bit in that getting to 90%. And then the boosters will help too, I'm imagining.
And I think the other thing is that, like, I think we just reached 1 million vaccinations yesterday countrywide. I think some of the people who have not been vaccinated in the past are getting the message that they better get vaccinated, because most people that are getting sick and dying are still, at least in our situation, are the ones who are unvaccinated. And, you know, I think it'll also help with these federal mandates. It also will help if the FDA actually approves the vaccination instead of just saying it's for emergency use. Then everybody will easily, in businesses, require people to get vaccinated to come to work.
Yeah, I know I've received a couple of notices from a restaurant saying that they're going to start to require that you show some proof of vaccination before you show up for dinner. So I think that kind of behavior is now becoming more common, where there was a hesitancy before about that. I want to make sure that if anybody here has a question that they haven't had a chance to ask, yes, Marsha, please unmute yourself.
Yeah,
And
my question is, supposedly Bainbridge has a really high vaccination rate. I don't know exactly what it is. I don't have the numbers relative even to the rest of the county. And this thing is spiking. And is there, you used to be able to find information about what groups it's spiking in. I mean, I don't need any individuals, but what's the profile of what's going on here?
Richard sounds like the right person to answer that first.
I might be. I could also. I'm wrong like 10 times a day.
Okay.
But you can go to the. I will tell you the both. I do a combination of the Kitsap Public Health.
That's what I've looked at, but you can't tell a lot. You just see more cases every day.
But there's dashboards. There's little there's levels below that's called this. You're talking about the surveillance report. That's sort of your big picture.
Yeah.
But there are dashboards for all sorts of different topics that break it down to vaccinated, unvaccinated, ethnicity, the works. So
Okay.
you actually can get a little bit deeper. And if you want to really go crazy, you can go to the state's data sets, which will give you granular information on Kitsap.
Okay.
So, you know, the surveillance report, which a lot of people see because it's a thing that shows up in the newsletters and stuff like that. But there's more. Just click onto the where it says dashboards on the.
Okay,
that.
so look for more of those dashboards. Okay.
So, but tell us, Richard, what we know about the people who seem to be getting infected and the people who seem to be getting sicker. You already mentioned the idea that hospitalizations are largely targeted on people who are unvaccinated.
Correct. But in terms of getting the infection, I know gossip. I know that it's younger people, but there's actual statistics. Oh, Dr. Hoffer may have some info.
Well, there was this concert that they had on the Columbia River, in the Columbia River Gorge, where they're outdoors. I don't know if they're vaccinated. And I don't know if they're wearing masks, but they were outdoors. And I think about 200 people or more got infected. And those will be people probably, I don't know, 20 to 30, maybe some years of age. And I think that was one of the thoughts that why we've had a spike here, is because of some of those was transmitted from that large population.
Yeah, there was also a concert in Kitsap that apparently had a similar effect. And so, yeah, I'm guessing that again, Marsha, it comes down to the transmittability, the idea that you don't need to have the kind of exposure that you used to for alpha. We used to say, I think it was 15 minutes of exposure was likely you could get sick, but now it's much less. A couple of minutes or 3 minutes could be enough to catch enough of the virus, because somebody is expelling so much more of it than they were before. So that's, like you said, Dr. Hoffer, that's scary, because it means what kinds of things are safe. Certainly, if you're going to be with other people, and when we started this a week ago, started remasking, those of us at the senior center thought, well, we're all vaccinated. So once we get into a classroom or an activity, it should be safe to remove our masks. I don't think so now.
I would not be in a closed room even with vaccinated people. No, me personally.
Right.
Well, it's kind of interesting. We're getting to the crux of a public policy debate here, and I don't want to get political. I don't care about politics that much. But when I was a little kid, they used to line us up in the Catholic school, and we were really good at standing in line, and we were really good at shutting up. We did those two things really well. And one day, no big announcement, they took classrooms into a room, and they had this little air gun, and it was Dr. Salk's air gun. And those were some of the earliest polio vaccines. There was no public debate. This is what we're going to do. If you want to go to school, then you're going to have to do this. And if you don't want to, then you're not going to be in school. Polio, they stopped giving these shots in the 70s because polio is basically in the United States been eradicated. Too late for a family friend who was a little girl in the 30s, who was in a wheelchair for the rest of her life, came to every one of the family parties. But there's real world, I see the little connections between the difference a decade makes, a difference a couple of weeks make. And why well, okay, now I'm getting political. I don't see any reason that this can't be mandated. I understand the doctor's point, which is, well, we got a legal situation here with these emergency things. And it doesn't look like Moderna is going to be anytime soon for kids, based on their recent investigations on the myocarditis.
From what I hear from my friends, from the parents of kids, it's the lack of trust of the government. And I think that's probably what's done it in the last decade, if you will.
It may be. I mean, that may be it. I'm just bringing you back to the halcyon days of the 1950s, where when Jonas Salk said we're going to get rid of polio, there was a little air gun, whap, 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 whap. And they went through these kids. It was so fast. It was like 15 minutes. We were back to drawing our pictures.
Well, I would say the other thing is that, collective memory of humans is not that impressive. And so our short-term memory about the risk of a pandemic is, we're relearning that, I guess, culturally as well. Yes, Fred.
The other cultural problem, as one Louisiana doctor said, is not the disease, it's fighting misinformation. Because misinformation is what's actually killing people right now.
And we're going to talk a little bit, as a matter of fact, on Monday about misinformation and the challenges of trying to regulate public discourse. It's not an easy thing to figure out. We're in a wild world, but that's happened before. The idea of bad actors giving bad information over public airwaves has happened in the past, and our public airwaves now are not only the actual airwaves, but the internet. So that is not a happy way to end this, I don't think. But I do think that the idea that that this is another time to be cautious is well taken.
And I also just want to do a little thank you, because I never say anything nice about City Hall, but in January, February, the way I'm just going to talk about Bainbridge, which is why I like to live here. The way people came together, the way the doctor offers, I believe doctor was on another podcast that I used to be part of, and the way everybody came together to make sure everybody who wanted a shot, even if we had to come cart you, we'll cart you. We don't care. Or we'll come visit you. We don't care. That got us up to, I think, 77 to 80% vaccination. The problem is there are going to be other deltas. Better to have shots than not have shots. Better to get the infection and have a cold for a couple of days than to end up in a hospital with
Get the inoculation and have the side effects. Absolutely.
Yeah, this is a very American thing. It doesn't work all the time. Well, I don't want that one.
I think the other resource that we have when we're starting to do boosters, we'll probably start with medical workers and people in nursing homes, and then start going with the most elderly down, just like we did originally. But the state, the county has a system that we have stopped doing our mobile clinics ourselves, because the county has a system. If you give them 30 days notice, they will have somebody come out and give you an immunization in your home. So I think you should let people know, especially with shut-ins, that is a resource that is available at the county level.
Great. And you can also follow information from the city emergency management coordinator, Ann Lesage, keeps the city website up to date. I'm doing the best I can on biseniorcenter.org, and the Kitsap County Health District website, kitsappublichealth.org, is also a good place to find out the latest information. And so I want to thank you, Dr. Hoffer, for your work in the past, and obviously you're gearing up to do some more, and we appreciate that.
It's nice to hear from Richard, and thank you for getting this together, Reed.